All right, people, we're back again for episode 26, season 2. What's going on, Tony? How you doing, brother?
What's happening, man? What's happening? Another day, another dollar.
Yes, sir.
Another day,
Yes, sir.
another 50 cent. I'm sorry.
Another quarter for me, man, but we
Yeah,
good. We good. But hey,
good.
people, man, thanks for coming back, man. Tony was giving me some good news, man, on our subscribers, man. We are at around 80. We are trying to get to 100. So if you're listening to this, please hit that subscribe button, man. You'll get all of our new content every week, all our discussion. You can comment, but go ahead and hit that subscribe. It's free. It don't cost you anything. But we got a good show tonight, man. This one is more health related. We're going to talk a little bit about prostate cancer, which is incredibly high in our community amongst Black men. And I'm going to give you a little story about some medical procedure I had and how there is a difference in the way the medical field can treat people depending on, who you are. And then we're going to talk a little bit about prenatal and pregnancy care for Black women. Again, we know that there is a difference in the way you're treated medically. And we're going to talk about how you can advocate for yourself to ensure you're getting the best medical treatment that's out there that you're paying for, essentially, because you're paying for that through your insurance company. So I'm ready to go, Tony. Let's go ahead and kick it off.
Okay, we're gonna kick it off. Before we get started, I'm gonna a poem that I found on the internet. I'm gonna talk about this poem a little bit. And then I just want everybody to know that we're going to talk about prostate cancer for men and how it affects the Black community. But we're not just going to stop there. We're going to talk about other things because Sulayman got some good things he want to tell us about other other medical conditions in the black community for Black men. Then we're going to go to our queens and we're going to talk about a little bit of that and some of the other things, like he said. So here's a poem, real quick. We've been waiting in exam rooms and emergency wards, in silence and in sorrow. But this month we speak for our fathers and our sons, for our mothers and daughters, for the legacy we refuse to lose. Short and sweet, I just wanted to share that with you. So we're gonna kick off the show talking about Black men and prostate cancer. It is a big deal. I got some facts and figures for you that I'm gonna go over with it and stuff. Prostate cancer for men. 1 in 6 Black men will be diagnosed with prostate cancer in their lifetime. That's in your lifetime. 1 in 6. Prostate cancer accounts for 37% of all cancer diagnosed among Black men. Black men are over twice as likely to die from prostate cancer compared to white men. They are more likely to be diagnosed at a younger age and with aggressive, fast growing tumors. Screening rates are lower. Only 33% of Black men report receiving PSA tests compared to 37% of white men. Neither one is a good number, but you can see that we're less than what white men are going in and getting screened for. Black men are underrepresented in the ethical trials, despite having the highest incidence rate globally. Okay, those are a few stats about prostate cancer. And we're going to talk about it a little bit. And then at the end, towards the end, I'll tell you about my personal story real quick uh, because I have personal experience with prostate cancer. So, with those numbers being said, and 1 in 6 in every Black man will have prostate cancer, but only 33% are getting tested, get screened. Just talk about that a little bit and how those numbers are oxymorons pretty much. You're going to get it. You're more likely to get it, but you're less likely to get screened.
Yeah, I mean, I'm going to be very, very raw here, man, and try not to get, banned off of YouTube. I'll be very honest, man. I mean, this is a very serious conversation. Black men, I don't get it. I mean, this is something that I'm going to be very hard on Black men about. This is ridiculous. The test for this is simple. Okay, this is a very simple test. And your doctor should be, if and I have no issue with saying my age. I'm 56 years old. Tony, how do you mind saying how old you are?
I'm 68.
Okay, Tony's 68. I'm 56 years old. Men our age and younger should be getting tested for prostate cancer. Period. You cannot just ignore it and think it's going to go away. It's not going to go away. If you have it, you have it. You need to find it early. The earlier they find it, the earlier they diagnose it, the better chance you have of surviving and getting help, get it taken care of. There's no reason in our community, Black men, that we should not be getting tested for prostate cancer. We know that it took a lot of our fathers and our grandfathers out of this world. We know that because we experienced it. And I get it that there's a taboo in the Black community, but it's a silly, stupid taboo. Go to your doctor. And if your doctor, you're our age, or I would say 45 and above, and your doctor is not telling you to get tested and constantly on you about getting tested, then you need to switch doctors because he does not have your best interests in mind. Go get it taken care of. Most of us have reasonable insurance that will take care of it and pay for the tests that are required. It's a simple test. You get the results back within a few days and you move on from that point. But ignoring it and sticking our head in the ground is silly, is stupid, it's killing our fathers, it's killing our husbands, it's killing our cousins, our brothers, people who are going to be people who are going to be successful in society. Is killing them because we are so taboo or so against going to the doctor and getting it taken care of. So please, Black men, stop this. Look at the percentages of the diagnosis that's coming back on our people. Go get taken care of. Go ahead, Tom.
Exactly, man. That's I hope Black men will heed the warning that you put out there. And to be very honest with you, I don't know if I would have done the same if my brother hadn't been diagnosed with prostate cancer. So by him being diagnosed with prostate cancer, you know how you fill out that little form at the doctor office and you be like, why did I fill this out area? And they ask you about your family history. And as soon as my doctor saw that, he said, we're gonna have to test you. We're gonna have to take a PSA from you every 6 months because you have a family history of prostate cancer. So you don't think too much about it, but it was an important point for me because I was getting tested every 6 months. And by being tested every 6 months, we kept a regular look at my PSA. And I would say about 3 years ago, it spiked up and then went back down for some reason. I don't know. So it was well within the range. For those of you that don't know, if your prostate is below 4, you're pretty much safe or good. So it spiked up and it went back down to about 2.5, somewhere like that. And so everybody thought I was good. So about November 2023, I went in and mine had spiked up again to about 380, somewhere in there. And then he said, we got to take a look at that again. So we're going to wait 6 months and take another look at. So we waited 6 months and this time it spiked over 4. It was in the fives. So first of all, I wasn't too alarmed because just because your PSA goes up don't mean you got prostate cancer. Could mean you got an enlarged prostate and it's easily treatable. So my doctor did a good job, but let me tell you this story. I'm sorry. Let me tell you this story before I get into that. When I went to take my PSA test, I was told that they were no longer required. This is what the lab person told me, no longer required. I said, but I want a PSA. She said, well, you're going to have to pay for it. I said, what? I said, I got Medicare and I got TRICARE for Life, which is military insurance. And I said, why am I paying for a routine PSA? She said, because they're no longer required. I said, why aren't they required? I'm a Black man over 50. Why not? And I got a family history of it. She said, well, I don't know. She said, let me look at this, look at my notes and everything. She did something. Then she came back and she said, um, I'm gonna put this code in and it should be free for you. I said, just in case, how much does it cost? She said, 100 and some dollars. I said, I'm gonna get it regardless, but let's put this code in. She put the code in and I got the PSA. Now, if I had been one of those guys that don't want to know, because I've been told on several occasions, I'm
Just
one of
walk
those
away.
guys, I don't want to go. Like, nope, don't want to take it. I ain't got to take it because it's no longer required. I'm good to go. So I was not one of those people. So I took the test over. Next thing you know, I'm doing a MRI And at this time, the only person that knows is my wife. I haven't told anybody else. I didn't even tell my wife at first until I had to go to the MRI. Go take the MRI, and the doctor said, "Well, looks like we got a problem here. Let's go do a biopsy." So all this takes about 3 months. This is a 3 month journey that I'm going through, and it's messing with your head the whole
Oh, yeah.
time because you don't know what's going on. So, uh, so then, about a month later, I get the biopsy and then take the biopsy, which is really not that painful, guys. I thought when I heard biopsy, I'm like, oh my God, man, this is gonna be painful. They gotta put me to sleep and everything. I'll be raw with it and everything. The worst thing I had was blood coming out of my urine for a little while. But as far as they put you out, as far as pain, there was no pain. And then pretty much after that, it's another waiting game, 1 to 2 weeks. So 1 to 2 weeks, my brain is killing me right now. I'm thinking all the worst and some of the best and hoping. So, so we get a call from the doctor. But when that urologist come up on my screen, because that's how I have my that thing, and you're hoping is his nurse, because if it's his nurse, it's good news. The
Yeah, yeah.
doctor don't talk if it's good news.
Right.
But when I heard my doctor's voice on there, I knew it was bad. I knew it was bad. And he said, well, let's not worry too much, but it is cancer. It is benign. And I'm going to need you to come in the office in 2 days and bring your wife with you. And so now my brain is really going crazy. So, and before I go any further with that, and like I said, I'm going to try to make this as short as possible. Before I go any further with that, I want you to know that my doctor, primary care doctor, who I think is a very good primary care doctor, he referred me to a urologist. Me, not knowing too much about prostate, which I should. I'm an expert in it now. I'm an expert layman in it now. But when he said urologist, I said, okay, that's good. It's not an oncologist, it's a urologist. So that means it might just be enlarged prostate. You know what I'm saying? So when I called the urologist's office and they said he's no longer practicing anymore. I'm like, well, why would my doctor give me a a referral to somebody that's not practicing anymore? The problem is, and I don't think he did this with any malice, is they don't care.
Yeah.
You gotta care about you.
Yeah.
You have to care about you. That was another out for me. That was another out for a person that really don't want to know. They could have said, I ain't got the referral, so I ain't going. You know what I'm saying? This happens. Over the past year and a half, I've talked to many men that have prostate cancer or are afraid they might have prostate cancer. And they are looking for an out. A lot of them are looking for an out. So that was my next out. But then again, I started saying, why would this guy do this? So now I'm gonna do my own research. So I start researching urologists in the area, and I got the best one I could find. It took me a month to see him, but I got to see him, you know?
Mhm.
And
Mhm.
so when I went in, this guy was robotic surgery. He was one of the best in the state on that, and one of the best in the country. And he had done numerous surgeries and stuff. So when I went in to see him, he was like, "What brings you here?" And I told him. So we did the test that all the men don't like, the digital test. We'll call it digital. Everybody know what that is. It takes about 2 seconds.
Sure.
Uncomfortable for 2 seconds for the rest of your life. Come on,
Exactly.
man. Come on, man. You know what I'm
Stop it,
saying?
man. Knock it off,
Yeah,
fellas. Knock it
yeah.
off.
Exactly. Uncomfortable for 2 seconds of your life. So he said, well, I can't really tell. He said, so I'm gonna get you to do another PSA. So he sent me across the hall to do another PSA. So he says it's still high, and that we're gonna have to. So once once we did that, he said, these are your options. You got to either, we can watch it. They call it passive observation. And I asked him, I said, that's an option? People actually do
Right.
that? Just watch it? Yeah, it's like somebody tell you you have a disease and you don't want to treat it, you know? You just want to watch the disease grow, I guess. So then he said radiation, chemotherapy, and or surgery. And radiation and chemotherapy just was not the answer for me. I didn't think, because I really didn't like the sickness during this, and it was an 8-week process. I had to go once a week for 8 weeks for this during this process, and during that 8-week period of time, you experience a lot of sickness sometimes, especially if you have to do the chemo. If you just do the radiation, it's no problem. It's a little less problems and stuff. So then I asked him to tell me about the surgery, and the thing with the surgery I thought was, get it out. Get it out. I want this out of my body. I got a intruder in my body and I want it out of my body. So for me, surgery was the best choice for me. Robotic surgery is minimum invasion. It's about a 3-hour surgery, and there are a lot of side effects, and we'll talk about some of those later. But fast forward to today, my surgery was October the 8th, 2024, and I'm coming up on my 1-year anniversary. And this month is Prostate Cancer Awareness Month. And I've been through a journey for the last year and a half. I've also been seeing a therapist, a mental therapist, for the last year and a half also, because it plays tricks with your mind. It's a mind game. I had no pain. I had no pain. I felt the best I felt in my life. And all of a sudden they tell me I got a killer in my body, cancer.
Yep. Yeah.
So it plays with your mind. How could this happen? But then I looked to the side and I said, my brother is genetics, you know? It could
Mhm.
easily happen. Just like it happened to me, it can happen to anybody. So long story short, there's a lot of stories in there. And the takeaway I want you to have is be proactive. One, once you find out that you may have prostate cancer, go through all the avenues to make sure that you find out for sure. And then
Right.
two, be an advocate for yourself.
There you
If
go.
you have the opportunity to choose your healthcare provider, choose them, and choose them wisely, because you do have a choice, you know? We want to do that. And the next thing is all the questions. Ask all of them. When he told me that I had 3 choices because I was stage 2, I had stage 2. When they find out if it's cancer, once you have the biopsy, they send it to the lab. The lab bring back all these numbers that can be confusing. You get a Gleason score. The lower your Gleason score, stage 1, stage 2, stage 3, stage 4. There's not 7 stages. There's not 10 stages to prostate cancer like our illustrious president said. Joe Biden had a 9 Gleason score. That's an aggressive form of prostate cancer. The Gleason score is 9. His stage was stage 4. His stage is stage 4. So our illustrious president didn't know the facts and came on TV and gave the wrong information. There's only 4 stages to cancer: 1, 2, 3, and 4. Your Gleason score tells you how aggressive your prostate cancer is. I had a Gleason score between 5 and 6, borderline 7. That put me in the stage 2 area. If I had been 7, 8, I would have been in the stage 3, and 9, 10, stage 4, so forth and so on. So it's sort of like that. And so the earlier you catch it, the more options you have. If you catch prostate cancer in stage 4, you have less options, and they have to treat you aggressively. And by treating you aggressively, you're going to have a lot of pain, a lot of sickness. And Joe Biden is going through this right now. He's getting treatment. The thing that they've come up with that prolongs your life, number one, is you do not have to die from prostate cancer. I'm going to say it again. There's a 99% success rate if you catch it early. 99. Who won't take those odds? If you catch it early, there's a 99% success rate. Okay. So if you catch it in stage 1, stage 2, you got all these options. Stage 3, you got some options too, but you got less options. Stage 4, they gonna go aggressive in your treatment and stuff, and it can be a long road and everything. I found out today, Montel Jordan, the young man that made This Is How We Do It, he had prostate cancer. He got surgery in January, and they told him he was a cancer survivor. And then he went back for his PSA, and the doctor saw some things he didn't like. So he is now not cancer free, and he's
Mm,
going to have some more treatment and stuff. But once again, because he was actively going to see his doctor, just because they tell you you're a cancer survivor don't mean you don't have to worry no more. I went in January of this year, of 2025, about 3 months after my surgery, and had a PSA, and your PSA got to say undetectable or zero point 0.5 to be considered cancer free. I was considered cancer free in January. So my doctor officially titled me a cancer survivor. I get to ring the bell and all that other stuff, which is a happy feeling, but it don't go away. Mentally, you're still in the game because you got to get checked every 6 months. So in June, my 6 months was coming up. So from May all the way till I took the test, my anxiety level went up. It went up because you wanted to say undetectable. And so went in, you take the blood test, and of course it takes a couple of days. It really don't take but one day. And sometimes it don't take one day. It might take 4 or 5 hours for them to get results. And they put it in your patient portal, but I don't look at it. I want to wait. I waited for my appointment with my doctor. Because when you start reading these things yourself, you start making assumptions that may not be right.
right.
So I don't look at them. I went to my appointment with the doctor. He said, "Congratulations, once again, you are cancer free." And he said, "Did you look at the results?" I said, "Nope, don't do it." He said, "Man, I'm so happy you don't." He said, "Most of my customers do, most of my patients do. And I would suggest that they don't because you start trying to read your own labs and stuff. That never turns out right most of the
Right.
time." So so Montel Jordan is one of those people that he had the surgery. They thought they had it all. They didn't have it all. So he's going back in for some more. And that's how it is with prostate cancer. I want to tell you another thing too. Radiation has come a long way. They have a type of radiation they call now, which is targeted. It is so precise that the chances of your survival with that is 99% also. But the thing is, you need to know about radiation and chemotherapy is once you decide on radiation and chemotherapy, if the cancer comes back, you cannot take it out, cannot have the surgery. Once you go down that route, you can't go back to taking a prostate out. The thing about taking it out, like I did with the surgery, if it comes back, I have a wide variety of treatments now. I can do radiation and chemotherapy and do this other treatment called hormonal treatment. Hormonal treatment is a treatment that they give you pretty much when they can't do nothing else. And what hormonal treatment does is freezes the cancer and makes sure it don't travel anymore. It's a very My brother does it now. My brother survived prostate cancer for 15 years. It came back, and now he's doing a hormonal treatment and everything. And he's almost 80 years old. So the medical, I call it technology, or the medical research in prostate cancer has made it so even if you got stage 4 cancer, you can live a long time with prostate cancer. But you got to be regimented and you got to stay on your game and everything. So that's the journey that I've had and I'm still going through, because you never not don't uh uh it never goes away in your head anyway. And it can always come back. Once it get in your My thoughts were once it get in your body, Where else is it hiding that they don't know about? You know what I'm saying?
Yeah.
Those things are some of the things. So, along with prostate cancer treatment, I suggest that you also have mental health treatment also, because you need all of it. My family battled with prostate cancer. We had two slogans. God's got me, I just got to do the work. That was our first slogan. Our second slogan was make the main thing the main thing. There's nothing more important than the gift of life and keeping that gift. So those were the things that got us through, and it's still getting us through right now. Make the main thing the main thing, and God's got me. I just have to do the work. And when I say that, man, that means you have to go get tested. You have to go get treated. You have to be the one that go out there and do these things, and involve your wife, because there's a long road back. And the final thing I want to talk about is the after effects of surgery, excuse me, and radiation also, is there's incontinence. You will have to wear those Depends for a little while. So what? You living. You know what I'm saying? You get to
Right.
go hold your grandkids. So what? You got Depends on. You get to
Right.
hug your wife. You get to hug your kids. You are alive. Make the main thing the main thing. And if you do pelvic floor exercises, I suggest to all men that have a problem with prostate cancer, I suggest you do pelvic floor exercises before your surgery and after your surgery. And you should also do it for radiation treatment also. Because what it does is it tighten up that muscle that you have, and you will get rid of the incontinence faster. Those that don't do this kind of thing, and those older patients, it might take up to a year to get rid of the incontinence. But if you do those exercises, I think my got out of Depends in about 12 weeks. So 8 weeks, you can't do nothing anyway after surgery. You can't do nothing for 8 weeks. So about 12 weeks, I was out of Depend. I gotta wear shields, because there's always that mistake.
Sure.
Even when you sneeze, you laugh, you cough, you do something, you might have a little mistake. So, but for the most part, incontinence has not been a problem for me. Then you have the one that every man fears, ED. It can be a beast, and if you're over 50, it can be a real problem, because as you know, some of us on our downhill then anyway. And
Sure.
it can be hard for you to get those back. But the earlier you catch prostate cancer, the more likely that this will not be a big problem for you, because in the surgery process, they don't have to damage those nerves. They can just they can pluck that prostate out there, because it's done with a robot, and a robot hands are more sturdier than a doctor's hand. And that robot just plucked the prostate out of there, and it won't damage those nerves in most cases. Now, if your cancer tumor was on the edge of your prostate, touching the edge, sometimes they will take those nerves just in case it leaked outside, you know? They don't want nothing outside there. So that's a factor too. But there's treatment for ED, guys. There's treatment for ED. And you're still alive. I go back to that. You're still
Well,
alive.
I mean, like I always say, man, I don't get this. I mean, okay, like you said, there's treatment for that, man. If you're one of those dudes that got that problem, there's treatments for that. You can go get that taken care of. But you, like you said, you get to hold your kids, you get to hold your
Yeah.
grandkids. You wake up every day, you get to hang out with your wife, go do
Yeah.
things with your wife.
Exactly.
So whatever fear you have or whatever taboo you have that you're worried about, you need to let that go, man. So
You
go ahead and
really
finish your
do.
story, then
Yeah.
I'll get into
Yeah,
it.
you really do. You really need to let that go. And that's a big problem. I've talked to many men that say that's the reason why they didn't have the surgery or the radiation. They did the active surveillance. They just kept getting tested every 3 to 6 months. I was like,
I
that's
mean, do
crazy.
whatever it is that you need to do, man, and to make you comfortable, man. But when a doctor comes back and telling you that you got cancer, you need to do whatever you need to do to make sure that that is gone, and
Yeah.
stop worrying
Yeah.
about
Yeah.
stuff that's irrelevant. You know
If
what I
you
mean?
like I said, if you over 50 or 60, your better days are gone anyway.
Yeah, you ain't
I'm
having no
just
babies
sorry.
at
Yeah.
50 and 60. I
Yeah,
mean,
yeah,
I ain't
yeah,
taking nothing
yeah,
away from
yeah,
dudes. I mean, we all out there doing
yeah,
our thing, man. But you ain't having no babies.
yeah,
You ain't
yeah,
impregnating nobody, man.
yeah.
Stop it. Knock it
You
off,
just
man.
ain't. I feel sorry for the guys that are 20 and 30 years old because it can really mess with your brain if you get prostate cancer that early in your life because it is a problem then because you're young. And if you don't have kids, you're not you won't be able to have kids anymore, and that's a sad thing for the young men. But for us old geezers and stuff, go ahead, man. Yeah, get rid of it,
Go get yourself taken care of, man.
but I'm gonna tell you a couple other things, get down and dirty for you so that you won't say that you weren't told this. Now, along with ED and sexual functions and all that other stuff. When they take your prostate out, for those of you guys that worry about length, you're gonna lose a little length. Just a little. Can't even tell properly, but you're gonna lose length and there is no more climax for you. There's nothing white coming out of there anymore. Nothing. You have what you can have an orgasm. It feels like you're having one, but nothing's coming out. Nothing's coming out. And the other thing is if you haven't been doing your floor exercises, and even if you have been doing your floor exercises and you have one of these orgasms, you might urinate because you don't have those two muscles anymore. You only have one muscle there now. So that one muscle got to do double duty. It's got to hold that urine and it's got to not fool your body into thinking that you're really having a climax because you're not. You just have the feeling of it. So that's the down and dirty. That might be something you saying that's too much information, but you won't have to say that I didn't tell you everything because I'm
No, it
telling you
ain't too much
everything.
information, man. People need
Yeah,
to hear this. You need to
yeah,
understand. I
yeah,
mean, you ain't the only person that gone through having prostate cancer. And lots of our people have gone through prostate cancer, but we're talking about it. You need to understand what's going on. So I appreciate that, man. I mean,
yeah, yeah. And it really is something. And in the comment sections, wherever you have wherever you have see our spoutable or wherever, if you want to know anything about it, just let me know. I'm a member of Zero Prostate, which is a nonprofit that tries to get the word out and get men out there. And when I go to Zero Prostate, I go to their website, all I see is white people for the most part.
yep.
1 in 6 Black men will be diagnosed with prostate cancer, and we're 2 times more likely to die from it, but only white people are on the website. I'm like,
Yeah.
"Wait a
Because we'd
minute."
rather sit around and talk about sports. We'd rather sit
Yeah,
around and talk about football and
exactly.
basketball instead of worrying about our
We
wives.
don't wanna
Uh,
tell our story,
right.
man. We
Yeah.
just
So
don't wanna do it. I will tell everybody the story anytime I can. If I can help save one person, I am. Go ahead, man. Tell us a little bit about the other killer for us,
colon cancer.
colonoscopy and stuff.
Yeah,
Another
colon.
taboo for Black
Right.
men.
Another taboo. So black men are at a higher risk for colon cancer, facing 20% higher incidence and 45% mortality rate compared to other racial groups for colon cancer. Now, for y'all young brothers out there, and I'm not gonna get too raw on it, for y'all young brothers or older brothers that are afraid to go get a colonoscopy, y'all need to stop. Knock it off. It's ridiculous. So when you go to your doctor, and we all, at one point, no one wants to do the finger test. We get that. No one wants to do that, but it's 10 seconds to save your life. More importantly, your doctor should be recommending that you go get a colonoscopy. And for those that don't know what that is, that essentially means they're going to put you on the table as an operation. They're going to put you to sleep, and they're going to go up in you anally to check your colon to make sure that you're good to go, that you don't have any polyps on it, which are cancerous that could kill you. It's an hour-long operation. They put you out completely. You don't feel anything. You don't know what's going on until you wake up back in your room, 45 minutes or an hour later. It's a simple process. Most insurance companies If they're worth their salt, this is a normal free procedure that you don't have to pay a dime for out of your insurance company, but it's going to save your life. Now, the story I wanted to tell you, we talked about it earlier before, Tony got into his story, is there is a difference in the medical community and how they treat people who share our reflection compared to other people. And the only difference is your avocation of what's happening to you. No one else is going to advocate for you but yourself. So my situation was my doctor, who I great relationship with, recommended a doctor. I go to the doctor. We go into the office. They do like a pre colonoscopy meeting. I didn't like the way he was talking. I thought it was very short. Um, to with me. I didn't think he really answered my questions. But my doctor recommended him. He said, okay. I went back to my doctor. I told my doctor I didn't appreciate it. I didn't think it was very good. I thought, he needs to go back to school for bedside manner. Doesn't mean he's not a good doctor. It just means he doesn't taught him how to talk to patients. So I ended up going and having the colonoscopy done, a little while ago, a couple months ago. Everything went fine. Before I go into surgery, he tells me, hey, we go in and we find anything, it comes back that is, cancerous or not, I'm going to call you within 10 days. We're going to go over your chart. It's okay, no problem. So go in, have the surgery, no problem. Get out of surgery. I leave. I'm thinking 10 days, okay, I'm going to get a response. I hear nothing from them for the entire time. I hear nothing from the place that did the operation, nothing from the doctor, anything. I get my chart back. I look at it. It's all a bunch of medical stuff. Tony, you've seen those before, the ones that come from the
Mhm.
lab.
Mhm.
I don't know what the hell it says.
Yeah.
I'm fortunate enough to have three doctors in my family. I mean, two doctors in my family. And I called my cousin up and I was like, hey, can let me send you something? I send it to her. She's a OBGYN. She looks at it and she responds, she says, hey, you're good to go. Don't worry about it, Sulayman. Everything's good. It's benign. They only found one. It's not a big deal.
Mhm.
I still hear nothing from the doctor. Doctor never calls me, never says anything to me. The place that I got it done never calls me, never goes over it with me. I call them, leave a message basically saying, hey, no one's called me, no one's talked to me. I know what the results say, but I'd like to talk to a doctor. I get no call back from the doctor. I send a letter, email in, complaining about the fact that I got no response. I hear nothing. Over the last 2 weeks, though, I've gotten probably 12 emails from them saying, oh, you owe us $90. That's my copay for the 12
It's
emails in
always the
two
money.
weeks. Right. Saying, hey, you owe us this money, whenever you get a chance, pay. So I finally call them and I'm like, I talk to a customer representative and I say, it's $90. I'm not worried about it. I'll pay you the money. I said, you guys didn't really give me the full service. I said, I still haven't talked to the doctor that operated on me. He still has not called me to talk to me about the fact that he found one. They sent it to a lab response back and says it's benign. It's not an issue. I had to call a family member. And I'm talking to this lady, right? She's a manager at their customer service or customer support thing. And I'm saying, I'm 55 years old. I'm not 25, I'm 55. And you guys have had me wait for 3 weeks to tell me about something that's important. Don't you think it's important that a 55-year-old man knows that he has cancer or he doesn't? Don't you think that's important? Don't you think
Mhm.
somebody should call and tell me that and explain to me what the chart says? And she's like, yes, Mr. Brown, I really apologize, blah, blah, blah. But the point of the matter is that I reached out and advocated for them. I've written all type of bad responses or bad evaluations and surveys on this company because that's important. Now, do I think he did it specifically because I'm African American? No, but I don't know for sure.
Exactly.
There's no way that he's in business if this is the way he acts. If you tell me before surgery you want to do something, and Tony can understand because I'm former military, I'm going to write it down. I'm sitting in my bed when he's talking to me before surgery. I'm writing down everything he says.
Mhm.
I'm giving it to my wife.
Mhm.
So I know what he said to me before I went into surgery. When I came out, I was a little shady, obviously from all the, anesthesia. But I
Yeah.
still had that piece of paper saying I know what he's going to do, and he didn't
Mhm.
do it. And then the company, the place that did it, they didn't even call me back. They didn't call me back. Didn't email me back. Nothing. So I've written all type of bad stuff about them. I also went to my main doctor and told my main doctor, you shouldn't be sending people to them
Exactly.
because this is what they did to me. So my point is to people who share our reflection, black folks, is advocate for yourself because they don't care. All they care about is the money they get.
You have to
They'll
advocate.
get right. Your insurance company is going to pay them the money for the surgery or whatever it is that they did. But if you don't push them to talk to you and tell you what's going on, you'll be in a situation that I'm in, or you'll be in a situation like Tony, where they're like, "Hey, it's not required anymore," and then you turn around and walk away, and then 6 months later, we're all burying you. So my point is, what I want to get across, the purpose of telling that story is you have to ask questions. Do your research on stuff that you're going to talk to your doctor about because your doctor's only give you 10 or 15 minutes. We all go to doctor's appointment, you get 10 or 15 minutes. But if you don't walk in there with questions and ask questions, they're not going to tell you anything they don't think you need to know.
They give you 10 or 15 minutes. They, allocate an hour. What people don't understand, they allocate an hour, and if they can get out of there faster than an hour, they will.
Yep.
They will. They will, and that's why they call us patients and stuff.
Right. Yeah, because I mean, and I just to go before that, when I went to my current doctor, my new doctor, and the reason I liked him was because he said to me, he was like, "Well, can you tell me why you left your previous doctor?" And I said, "Yeah, because he didn't listen to me." And my doctor said, "Well, what do you mean by that?" And I said, "He didn't listen to me." I said, "I'm not a doctor. I'm not here to tell you how to do your job. You went to school for 12 years. You obviously know how to be a doctor. I'm not here to debate that.
Mhm.
But I need you to explain to me what you're doing to me in layman's terms. I
Exactly.
need you to tell me, hey, Mr. Brown, I'm giving you this medication. Well, what does this medication do to me? What's it doing for me? And then what does it do to me?" Those are the questions you need to ask. All medication has side effects. It may fix the issue that you have, but it's
Exactly.
going to cause another issue
Issue,
in your body.
exactly.
And you need to determine whether I'm willing to deal with that second piece in taking this medication. That's
Yep.
called advocating for yourself and saying, "Doc, like I know I went into my doctor, I had some medication. I don't like the way this medication making me feel." He said, "Well, what do you mean?" And I told him exactly what it was doing. He was like, "Yeah, that's one of the side effects." He said, "No problem. I'm going to give you a different medication." So
That
that's
is
what we're
awesome.
telling you guys to do is to
Yeah.
advocate for yourself. And
Advocate
then let
for
me finish
yourself.
up, Tony, by saying prostate cancer kills black people at a higher rate than it does any other race. Colon cancer kills black people at a higher rate than it does anyone else. Go in there, put all your whatever it is that you're feeling, away. Yes. And I don't know if I'm gonna get banned or not, but yes, in order for colon cancer and prostate cancer, more than likely, they're gonna have to enter you anally because that's where those organs are. So you need to recognize that that is the case, and swallow hard and go get it done so that you could be with your wife, with your grandchildren, and your family for an additional year. It's ridiculous that we have such a taboo in our community about something as small and insignificant as that.
And something that you don't have to die from. Imma say it one more time, 9% success rate if you
Right.
catch it early
Yep.
and you treat it.
Yep.
Oh, don't do you no good to catch it early and then say, "I'm not gonna treat it." Since I had my story in this year and a half, I've known 2 to 3 people that died already that didn't have to die. Yeah. I got a young man, and while we at it, Imma go to the ladies in a few minutes, but while we at it, I got a young man that I taught in school. He's in his late 30s and had high blood pressure and everything and diabetes and didn't get none of it treated. He took his medicine when he didn't feel good. And
Right.
when he started back feeling good, he
Stop
stopped
taking.
taking the medicine. Now he said 2 weeks ago, I got a call from his sister, and he was sitting in ICU on a breathing tube till they can try to get him his blood pressure and everything back up where it's supposed to be. And his kidney is functioning at 6% at 36 years old. And now he's gonna have to stay on the kidney machine. He gonna have to get dialysis for the next 6 months. They gotta stabilize his blood pressure, blood sugar, all that stuff, And after 6 months, if that's all stabilized, he can get on the kidney list, transplant list
Yeah.
at 36 years old.
30
So we have institutional racism when it come down to healthcare, but we also have just us blatantly not advocating for ourselves and not doing the things that we need to do. So it goes hand in hand. Okay, ladies and gentlemen, see, this is what happens when we have live podcasts. And when we in charge of our own shit, we can say we're gonna have a part 2 to this. Okay, so we're gonna stay on the minute. This isn't.
We building while we flying,
Yeah,
man.
yeah. This is an important conversation, and it
Yeah, I
need to
think it
be
is.
had. And we need to make sure that Black men understand that they don't have to die from both of these diseases. Both of them are slow moving.
Mhm.
So if you catch it early, you can get rid of it early. And
Yep.
like I said, go see our videos, like, subscribe. We trying to get to that 100 subscribers in the next few months. If we could get it in the next month, I'd appreciate it. We're over 15,000 views now, so we're moving up on the viewership and everything. We just want to get people locked in because we're going to talk about real things from real people. We're no expert, but we do have an opinion, and we're not up here shaking our butts because don't nobody want to see that anyway. So
No, we just real people, man. Trying to help people out, man. I mean, I wish there was somebody that would have been talking to me, you know, when I was 30 years old, telling me about what I was going to go through and what I experienced, when I'm in my 50s. So we're just trying to educate some of these younger brothers that are coming up, man, and realizing take care of yourself is the key, man.
Yep. And last thing is we have a health secretary that don't give a damn about health. Go figure. You know, we were
Yeah,
talking about it off air about what's happening in Florida where they're not requiring any shots at all, not for children going to school or anywhere now. That is ridiculous. That
yeah.
is ridiculous. It don't make sense. It's like they're trying to kill people off. That's what they're trying to do. And I guarantee you that those state officials that made this law or this ruling or whatever, they are and their kids are getting vaccinated.
Oh, absolutely. We know they are. Just like
Uh,
all of them are taking the COVID shots. They'll sit
yep,
out here and they'll tell
yep.
their people, "Oh, we're not taking the COVID shot." They're taking the COVID
They're
shot.
taking the COVID shot. Like I said, with my experience with prostate cancer, and like Suleiman said, with his experience with his colonoscopy, you're gonna get it out because somebody's not gonna do their job. So you're gonna get it out. There's always gonna be an out. Will you take that out? Are you willing to risk your life to take that out or that risk? And I say no. Anything else before we go, Suleiman?
No, sir, man. Just hey, man, help us get our subscribes up, man, and our likes, man. So hit that button, man, when you check it out. We'll see you guys next week.
See you next week. Peace.